everybody. Welcome to Smiles Without Barriers. We are doing a dental podcast. We are Matheny. Matheny's mission is to provide exceptional care and an optimal quality of life for children and adults with special needs and medically complex disabilities. Today I have with me Dr. Melanie Hunt. She is a general dentist with over a decade of experience providing treatment for individuals with special needs and complex medical conditions. Dedicated to improving access to dental care, Dr. Hunt has built a career focused on serving patients who are often underserved and require a thoughtful individual approach. With a deep commitment to compassionate, patient centered care, Dr. Hunt works closely with patients, families, and caregivers to create a comfortable and supportive environment. Her approach emphasizes understanding each individual's unique needs while delivering high quality dental treatment with empathy and respect. She believes in an interdisciplinary approach to dentistry involving all members of a patient's care team to best support positive patient outcomes. Passionate about advocacy and inclusion in healthcare, Dr. Hunt strives to reduce barriers to treatment and ensure that every patient receives the care and attention they deserve. So, Dr. Hunt, I just want to welcome you. My name is Yvette Mosquera. I'm the Director of Marketing and Communications. And as you know, our dental clinic has been around since 2003, and you've served hundreds of patients. And it's very unique what you do because this population is so special and they have so many needs. You do such a great job with them. And so we want to tell the audience what we are all about. Sure. What drew you to specializing in dental care for people with disabilities? And is that different from general dentistry?
Sure. So I grew up locally, and I grew up in a household where my parents were very adamant about speaking about inclusion and diversity and disabilities specifically. I didn't realize it was unique when I was growing up because it was just a conversation that we had regularly at home. My parents were both local athletes, and they spent a lot of their extracurricular time mentoring and working with individuals with special needs. So again, it was stories that me and my brother grew up with. So it wasn't something I ever thought about. I just thought that was like a normal everyday thing. And then as I, went further in my education, I realized that that's a very unique experience that I had. It made me more open to caring for all individuals, where some of my classmates and colleagues, going through the educational process were a little bit more taken aback and, not as ready to jump in and serve everyone. Where again, it wasn't even a thought in my head. It was just, everyone, include everyone, treat everyone as they should be treated. And it really was important how unique my experience was growing up versus some of my colleagues, because it wasn't something that they thought about until it was presented in front of them. And they definitely were not as comfortable jumping in. But in terms of special needs dentistry versus general dentistry, the truth of the matter is I'm just a general dentist. I don't have any special training per se. I was just willing to kind of open myself up and be a little bit more experimentative with, how I approach treatment, not necessarily the actual treatment that's happening, and be more willing to be a little more open as to, what the ideal treatment and, treatment space looks like.
Amazing. That's such a good story. So, in your practice, what are the most common dental conditions you see in your patients? And why are people with disabilities at a higher risk for oral health issues?
Sure. So my patients specifically have the same general, health needs and general dentistry needs as any other patient, you or I. We have a very high caries risk, unfortunately, in special needs individuals. We have, we're very prone to poor oral hygiene in special needs individuals. A lot of that comes from the fact that, special needs individuals, that's a very broad category. There's, thousands of diagnoses that can qualify you as a special needs individual, intellectual and developmental disabilities, physical disabilities, and all of them kind of have their own, needs and, complications when it comes to oral health. Oftentimes, an individual with special needs may not be caring for themselves. They may be relying on others to care for them, whether it's a family member or an outside caregiver, or some type of outside, caring home. such as a group home or even, our inpatients at Matheny. So when you start relying on other people to take care of you, that adds a whole nother complex level of care that, oftentimes we don't think about. So, I can brush my own teeth. I know what I'm feeling. I'm getting feedback from myself. But once you add another person into that mix, it changes the whole dynamic. So, physical disabilities also that can be very, cause problems with their ability to physically brush their own teeth, access certain areas, their movement. So there's a broad range, but the general dentist needs that you or I may have or may face in the general population are all things that my patients face and special needs individuals do face, just at a higher risk, unfortunately. And it's because of the barriers to care that they face, the physical disabilities, and again, those caregiver needs.
So, given the issues, the mobility and all of that, can you tell me more about how the people that we care for who live with cerebral palsy, spina bifida, Lesch-Nyhan, how does that specifically affect their health?
Sure. So again, the physical needs that they have and the physical disabilities prevent their ability sometimes from caring for themselves. That's not across the board in all cases. So every individual is totally, just because they have the same diagnoses doesn't mean that they necessarily have the same care needs. But oftentimes we do see a greater risk or a greater sentiment of physical disabilities that are preventing them from caring for themselves. There's also, the comorbidities that go into this. You have one diagnosis, which may lead to multiple other diagnoses. And, the thing that I think gets lost a lot is your oral health is actually, it aligns with the rest of your, overall health. So many people think of the teeth as just being something that's contained to the mouth, when the truth of the matter is, your overall health affects your teeth and vice versa. So it's so important that, all of our individuals who are medically complex are getting oral care taken care of and getting their oral care regime, intact and, hopefully preventing further complications down the road, further complications in their mouth and further complications with their general health. So again, with the comorbidities that go on with a lot of these diagnoses, it's so important that we're also paying attention to the oral health of the patient.
Yeah, and I can imagine that in addition to that, there are probably several other obstacles to dental care. So I'm wondering, how do you address this specifically in your practice? How do you modify the environment? How do you help people with sensory sensitivities? What tools, technologies do you use?
Sure. So again, this is one of my favorite questions because at the end of the day, like I said before, I'm just a general dentist. I don't have any special training. I was just willing and wanted to treat this population. And I think if we can leave here with one thing and one sentiment, it's really that just kindness and patience really goes a long way. You would want to treat any individual coming into my practice, your practice, the same way you would hope to be treated or a family member of yours. So at the end of the day, when patients are coming to me, my number one priority is them and their comfort. So the biggest thing is behavioral techniques. So really assessing the patient, finding out what their needs are and what would make them most comfortable. That may mean the first visit we're taking a little bit more time talking and speaking and, learning about each other. But in the long run, that really sets us up for success. We also do have things such as weighted blankets. We have iPads. We have, a interactive TV. We have other things in the practice that can make them feel a little bit more at home and a little bit more comfortable. But at the end of the day, it's really the relationship that we build with each individual and making sure that we're not just sticking them in a box because of, again, a specific diagnosis, but we're really taking the time to find out what each individual needs to make them as comfortable as possible and to make their care as successful as possible.
That's amazing. I can tell that you care a lot about the patients, and so you take the time to get to know them. So when it comes to our patients, I know that a lot of them may not be verbal; they may be nonverbal. What else, do you do to be able to communicate with them and learn
Sure.
how they communicate?
That's a great question. So I love to say that communication is not just what you're saying, it's mostly your actions. So you'd be amazed how much just taking the time to get to know an individual, even if they can't necessarily verbalize it back to you, can really set someone at ease. It's also important for me because, again, just because someone has the same diagnosis as another person doesn't mean that their care needs are going to be the same or that they're going to respond to me in the same manner. So getting to know them. A lot of our patients that come to us have other communication devices. So it might be an iPad. It could be a communication board, sign language. Sometimes their care aides are able to assist in some type of communication that's set up for them. We also, if they have an iPad or something that they're comfortable typing for us, we also, we include all of that. I like to include the entire care team. Oftentimes, we also have therapists that show up to appointments, behaviorists that show up to appointments, because their care team knows them best. So being able to kind of incorporate the entire care team can also help increase communications. It's amazing sometimes where someone might be apprehensive because it's me and I'm new to them, but the moment they kind of have someone from their care team who they're familiar with and sees them interact with me, how much, like, what a door that can open for their treatment.
Great. That's good. What other barriers do our patients face in addition to what we've already named? Are there any other barriers?
Sure. I would say for our patients specifically, transportation is always a number one barrier. A lot of these individuals are wheelchair bound, and transportation in general is extremely difficult for them. Also, the fact that many of them do not drive themselves, they're being driven by someone else. So, in terms of cancellations and stuff like that, a lot of times it's simply a transportation issue and they're not able to get where they need to be for care, which is, very unfortunate. I think access to care is obviously one of the biggest obstacles that this population faces, simply because most general dentists feel that they don't have the capabilities of treating this population, when the fact of the matter is, again, it's just general dentistry. So, access to care is really huge, and finding, a general dentist who's willing to treat them and open up their practice to them is probably the biggest obstacle across the state.
Yeah, and basically what you're saying is anybody can do it,
Yes,
right? It
yes.
just takes a little more time to get to know the
Correct.
person, and and they may be surprised, right? Once they get to know the person, that it's not as difficult.
Yeah.
Probably.
It's heartbreaking to me to hear the caregivers and the parents and the patients themselves speak to how, until they came to Matheny, they had seen multiple dentists prior and they never felt comfortable enough to stay at a practice, or they were, juggled around between practices. Yet they came to Matheny, and in my mind, I'm not doing anything super special. I'm just
Special, yeah.
treating them how I would hope I would be treated or my
Yeah.
children would be treated coming to an office. And the reality of it is, again, I'm just doing general dentistry.
Yeah, yeah, that's amazing. That's what makes, I think, your dental practice special. So going back to what you were talking about, the oral hygiene and the routines, what advice do you have for caregivers, parents, families, on how to improve their oral routine?
Sure. I think the biggest thing is, a lot of times I hear is, oh, they won't let me, or, oh, he or she won't. And the fact of the matter is, exposure therapy is a huge thing. It's something I use in the practice, especially with our inpatients, to help increase their reception to, oral care in general. So, constant re-exposure, trying. It's amazing what, re-exposure can do and how quickly things can change over time. Even, a patient who may be really apprehensive and orally defensive, 1 week, maybe having a completely different week the next week, and having that constant re-exposure and them understanding, okay, well, they're not going to give up. So, maybe I'm gonna allow them to touch me with the toothbrush today, or, the constant re-exposure therapy is probably the number one technique. That being said, too, trying and seeing and, experimenting is really helpful. Every toothbrush is not perfect for every patient. I always get the question, oh, is the electric toothbrush better than the manual toothbrush? Or should I use, this special toothbrush I saw on Amazon, or should I just have a regular one? And the truth of the matter is, everyone's different. And if it works for you, that's what's important. So, trying different techniques. You may not be able to swish with mouthwash, but maybe you could use an oral toothette swab and have the mouthwash delivered in that manner. Maybe we could put the mouthwash on the toothbrush and deliver it in that manner. Maybe we need to try a new flavor. So, experimenting is really big, and finding out what works best for each patient. Every patient is different. So, I wish I could sit here and give you a list of this is what you do, and you check that off. It's perfect. But every patient, they certainly teach me that on a daily basis, but every patient's different, and every day is different. So exposure therapy and trying and seeing what works best for the patient is really most important.
Great. Thank you.
Mm-hmm.
So, was talking about families who are probably maybe having trouble finding a good dentist for their families. You touched upon it a little bit, but what would you suggest to a family on how to find the best, I guess, care for their child?
Comfort's most important. You want to make sure that you're comfortable and you're asking the questions and you're getting, receptive answers back when you are calling. In fact, I just worked with Delta Dental and we worked with the Institute for Exceptional Care. And we created a special needs toolkit. So basically, it's a toolkit for individuals who have intellectual disabilities as well as potential general dentists who would like to start including them in their practice. And in that toolkit is examples of the questions that caregivers and parents and family members and patients can be asking when they call to set up a new patient appointment with any general dentist. Accessibility needs. If they're in a wheelchair, can the wheelchair fit? Is there a wheelchair ramp? Do the wheelchairs fit in the operatory? Um, Questions about communication. Are they willing to use a communication board with you? Are they willing to have, you're the caregiver sit in and help communicate for them? Does that caregiver have, the right training or, the right responsibility in that patient's life to be doing some of the translating? So they're all great questions that maybe a caregiver would not normally think about. And this toolkit is really comprehensive. We spent almost 2 years on it now, trying to create this toolkit as a resource for the patients, the caregivers, and the general dentists. So that's a great resource, and we could definitely post that for anyone that needs it.
Great, we will. We will post it. You touched upon a little bit about the questions that the caregiver should ask. Is there anything else that they should be asking and maybe, encourage, right, people to
Sure.
ask questions? Because a lot of times I feel like
Yes.
we become a little intimidated by our
Absolutely.
physicians or our doctors.
There's
But
no stupid question. It's only the ones that aren't asked. So certainly, when you're there, I always recommend that the patients and the caregivers kind of speak up. And, that's their chance to ask questions. It's their chance to say, you know what, it's not working and I've been brushing their teeth and, you're telling me maybe I'm missing a spot. Can you show me how to do it? Don't just sit back. It's the only time you get to really, ask the questions, see the firsthand, treatment and examples. But don't just sit back. Ask the questions. It's never too much. And I always tell the patients, don't be afraid to give me a call. When you go home and you're rethinking, the
Yeah.
appointment and all of the information that I presented to you, it can be really overwhelming. When you have a chance to really kind of process all of it, if you have questions, call. It doesn't have to be I'll see you in 6 months, I'll see you in 3 months, I'll see you next year type of thing. We're really a part of your care team. So make sure that you're, using us for whatever your needs may be.
thank you.
Mm-hmm.
So going on to what can dentists do? We talked about the families, what they can do to advocate for their child. What can a general dentist do
Sure.
to help people with disabilities?
That's a great question. So I think just being open and willing, I was educated at a wonderful dental school. And I luckily was very interested in this population and very willing to jump in, like I explained. But I had wonderful classmates and colleagues who, I could see them kind of take a step back. And part of it is the way that we're, trained, and part of it is the way that it's presented to us. But just being willing and open to the idea of treating special needs patients in your practice is huge. I hate the term special needs because it's so encompassing.
Yeah.
And it's a special needs community. And in any community, there's such a broad range of individuals. And labeling with the idea of special needs and like, oh, I can't treat them because they're special needs is really, it's really rather uninclusive. And, the fact of the matter is if you try, you'd be surprised how many special needs individuals can absolutely be treated in a general dentist's office. That first visit might take an extra few minutes to get the patient get used to the office and understand the patient's needs. But the fact of the matter is I always hear the time thing, oh, it takes so much longer. But the fact of, the reality of it is, and the facts of, patient care is that these patients are oftentimes, not going to be able to sit in a chair for 45 minutes and, have something done. So the time aspect of things oftentimes are a little bit shorter. We need shorter appointments for the patients and, maybe more frequent appointments for the patients. But the time aspect of things is, just kind of an easy way out. But trying, just putting forth a little bit more kindness and compassion, and just being willing and open to the idea of it is really the number one step. And I think most general dentists would be shocked if they did open up their doors and, start seeing some individuals with special needs, really how similar it is to everyone else that comes in their practice.
Yeah, one of the things that I think, I love about Matheny is how we make sure that every patient, resident, student is treated like you and me,
Correct. Yep.
we're all just regular people trying to
Mm-hmm.
get by our day.
Correct.
And, our patients, they have hobbies, they have interests, they have, talents. And why not,
Yeah. Yeah.
when you're going to a doctor, why not get treated the same way?
Correct.
So I hope that with this information that you're giving us today, that maybe, it might open people's minds about how to treat, certain patients. Just because they have a diagnosis doesn't mean that they can't be, receive the same medical or dental treatment that
Absolutely.
I would receive, for example.
The burden that falls on these patients because of the need to find a special needs dentist in the state of New Jersey is, rather astounding. Just the travel alone. I have patients that travel upwards of 3 hours to come to us because
Wow.
no one local to them is
Wow.
willing to treat them because of their diagnosis. Not that they've ever met them before or tried
Yeah.
or, simply because of their diagnosis. And I think that's really the heartbreaking part of all of it. These patients are trying to find the care. It's just not there. So, if we can even convince one general dentist to see a patient in their community so that they don't have to travel 3 hours to, have a cleaning, that would be wonderful.
Yeah, yeah, I love that message. With that said, what are some of the resources that exist that family can use online
Sure.
or wherever?
I think the number one is the American Dental Association does have a link on their website for special needs practices or practices who are willing to treat special needs individuals. I know in the state of New Jersey, the ADA links to the New Jersey Dental Association or the NJDA, and there is a list by county of practices that say, yes, we are willing to treat special needs. And there's other qualifiers there to help, individuals find the care that they need.
Okay, great. Do you want to tell us a little bit more about your practice, and do you take people from the community?
Sure. So Matheny's Dental Clinic sees all 101 inpatients that are residents at Matheny. We also see all of Matheny's group homes, but we most importantly also, open up the doors to outpatients. So we see local group homes. We see individuals who live at home with their family and some parents still, and then we also see just the general public as long as they qualify with their diagnosis.
Okay.
So
Okay, wonderful. Thank you so much. Any other closing remarks or closing thoughts? Anything that we didn't talk about?
I think it's just, especially with the anniversary coming up, I think it's, just a point to say that, Matheny is really a wonderful, wonderful place. And it's the mission for the patients is really what we're all there for and all about. So, just if this is your first, idea of what Matheny is, there's so much more going
Yes,
on there.
there
And it
is.
is just such a beautiful place to be a part of. And we get so much in return for everything that we're giving. So, shout out to Matheny just for everything that they
Yes.
do and what a wonderful environment it is.
It is. It's really a team of interdisciplinary professionals who, come in and they just do what they have to do to make sure that the work gets done. But I also want to give a shout out to the Delta Dental Foundation because they were instrumental in making sure that the dental clinic opened
Absolutely.
in
And that we
2003.
remain open. Yes, absolutely.
And that we remain open. Yes,
Absolutely.
they've been such a steady supporter every year. So I just want to thank Delta Dental for that. I also want to say in my closing remarks, thank you to everyone who listened to our talk today. If you want to learn more about Matheny, please visit our website at matheny.org or follow us on social media. There's always something fun going on, right?
Yes, absolutely.
And we post almost on a daily basis because our guys have so many activities and so many things going on. It's hard to keep up with them, to be honest
It
with
is.
you. But I want to thank you, Dr. Hunt, for sharing your knowledge, for being so kind, to not just us, but to our patients, and for the work that you do is really special and it's amazing. And I hope that we continue to share this information and inspire others.
Yeah, our patients are incredible, incredible people, and they inspire us every day. So I hope everyone takes some time to really learn about the individuals that we're caring for and that really make this all worth it. So,
Yes. Amen. Thank you.
thank you.